Hi everybody, so this will be my cardiac 2 and blood presentation. So let's get straight into it about what we're going to cover about the human blood. So we're going to cover, we have blood in our veins, but I want to talk more specifically about it. So we're going to talk about erythrocytes, which is just basically your red blood cells, the different blood types that this causes, and also how our blood can react in the wrong way during a transfusion if proper techniques or blood types aren't used. So first, let's talk about our red blood cells. Again, these are called erythrocytes for the technical term, but I'll probably just say red blood cells or RBCs. So these cells are different from other types in your body. These cells don't have any nucleus or organelles in them. It makes room for other processes like oxygen diffusion to occur more easily. Again, like other cells that can last our entire lifetime, these cells have a very, very short lifespan compared to those. Usually it's only about 120 days, so about 4 months-ish. There are a ton of these red blood cells in our blood. They say that there's about 5 billion in each milliliter of our blood, at least on average. And the purpose of the red blood cells is to transport oxygen throughout our body. And right here is a picture of our bones. So here's part of our bone, here's part of our bone. They're connecting. Inside, you see this kind of mesh network, and in there, there's some redness. So I said that the RBCs have a very short lifespan. Well, if that's the case, then they have to be produced somewhere. But if there's no nucleus or organelles inside of there, how do we gain more red blood cells? How do we maintain that constantly in our body? So what actually happens is inside your bones, we have probably all heard of bone marrow. And inside that bone marrow is where new RBCs are produced. They're created, and then once they have matured, they are released out into the bloodstream. So what do they actually look like? Cells, you generally have, little circular things that are shown. Here's my cell here, and there's always a bunch of stuff inside of them. However, your red blood cells are actually like a little flat disc, but they're not perfectly flat. So instead of a nice oval, I'll do my best to draw that. Instead of just a nice flat oval disc, there is actually an indentation. And there's an indentation on both sides of it. Well, let's try that little part again. Get this the best here. So it caves in. They call it a biconcave form. So, I still need to make the cell, so I need to make it my disc and make it connected. But what happens is this part is caved in, and this part. When that happens, my surface area of that cell has been increased, which means that more is beneficial for the oxygen diffusion to occur. But also, since it's caved in, that makes this really thin. And that allows for the exterior and interior diffusion, that movement from one side to the other, to occur very quickly. Now, inside of these, all inside here, where I said the diffusion can move through, but there is also inside there, it is full of hemoglobin. Now, hemoglobin is not found anywhere else in the body. They are inside your red blood cells. And what they do is they help transport that oxygen. But they can also pair with other gases and other materials, and they help either move things from place to place through the body, or they help counteract the wrong pH levels, and they can counteract to help maintain that proper healthy pH level in the body or in your blood. So hemoglobin is very important, but it is very beneficial just because of the shape of these cells. Okay, so now that we know what red blood cells are, let's talk about, why we have different types of blood. So antigens, we always hear about antigens from, bacteria. Antigens, they're going to be molecules that cause some kind of immune response. And when they get into your body, we have antibodies that fight those antigens. Well, we actually have antigens on these, or in these red blood cells, on the surface of them. And so you want to make sure that you have the right antigens in your blood so that the antibodies that would fight against them, they don't mismatch. They need to work together. So antigens, again, are on the surface of your red blood cells. So the four main types, you have type A, B, AB, and O. If you are called type A blood, that means you have A antigens. They only want A. So they are going to want to get rid of any B's that would occur. So they're going to have B antibodies. Blood type B, again, it has the B antigens. That's why it is called type B. And they're going to want to get rid of A's. Now, ABs are special because they have both A and B antigens, which means they don't need any antibodies because they don't want to get rid of any of them. O, they don't have any antigens, so they can have antibodies for both A and B. They can have both because none of them need to fight against each other. They don't want to get rid of any of them because they don't have antigens to begin with. So type O, they say that they can give to anyone. The reason for that is because they don't have either one of these AB antigens. So these antis won't fight against if you give them to them. AB, it can also be given. If there's no antibodies, then if you give it to A or B, it's not going to want to fight against them. The antibodies won't destroy anything. But if we think in reverse, O type can only receive O type because it can't have antigens. If it were to gain an antigen, then these antibodies would cause an issue. So O type can only receive O. Same with AB. So us understanding blood types helps with donating blood, saving lives, help fixing issues or medical issues. Knowing someone's blood type is very important because of the whole antigen-antibody reactions that can happen. So speaking of these reactions, what happens if you get the wrong blood? You are going to have and could have some serious repercussions from that. So if someone donates blood to someone else, if they're given the wrong blood, the donor blood can basically be attacked by that person's body. So the donor blood could either clump, it could clump them up, cause them to kind of fuse together, which is going to clog blood vessels up, which will cause serious health problems, medical issues. But then the donor cells could also break, they could rupture, causing hemoglobin in the plasma in our blood, and that would not be good, and that result can be acute kidney failure. So having the appropriate transfusion, right blood to the right person, is extremely important. Now, on that note, it's not in terms of humans, but using what doctors knew about transfusions and their reactions with different types of blood for humans, I ran across a case study that yes, it originated in 1995, but it just recently in 2015, it became available online. More people started to have access to it, and I just found it a very interesting paper that I read that talked about the need of vets and transfusions. So apparently in 1995 there was a huge issue with cats being anemic. And vets, when dealing with dogs, they don't usually have blood issues because they don't have any antibodies that naturally occur in their body. But cats do. They have naturally occurring antibodies like humans. So this study was to analyze all the different cat types so that veterinarians could use that information to help save lives, help save or cure medical issues with cats that were brought into them. So what this study did was they looked at different countries. You can see in the table it focused on, they used the United States, Australia, and many countries in Europe. I know a big focus was helping vets in the United States, but with as many cats that come from other countries or that are here or there, they included them in the study. So this study went and they categorized or blood typed over 10,000 cats in a 6-year span. And what they did was that they used a system called back typing. And this is similar to blood typing, but what they did was that they tested against the patient's plasma, the blood types that they knew. They would test them against its plasma to see if that clumping occurred. And that's how they kind of went through process of elimination in their trials or their little tests of what kind of blood type the cats were. And what they learned was cats, they have 3 basic types. They have A, B, and AB. So similar to humans, just like how we have naturally occurring antibodies and have A, B, and AB types, so do cats. And so you can see their breakdown. You can tell, how many cats they looked at, of where in what region in the United States, and they broke it down to type A and type B. Now they noticed there were a lot more type A than type B. So down here at the very bottom, it talked about in purebred cats, they broke down, which type of cat had 0% type B cats. And then you can see here's the list where 1 to 10% of them were type B, then 11 to 20, and 20 to 45. So they really went through and even broke down by breeds for these vets. Now, the reason that this was so important, why, you think, a transfusion, a vet, how is that really a huge effect for them, or this to be an issue for them to learn about? Well, after doing their research and gathering all their information, they found that if you look up here at this table, so recipient A, receiving donor A, they survived, their sickness, they either got better, they lasted longer. But this dashed line here, the little one, is they were type A, but got type B. And on average, those cats survived 2 days. So, it's safe to say they didn't survive that transfusion. So 2 days, that's a failure. But then you look over here. We said very few cats were type B, but if they were type B and they got type A, the survival rate was even less. They died within a couple hours. The average was 1.3 hours that those cats survived after that transfusion. So after reading this article, I found it very obvious that, vets, and I guess at the time there's a lot of anemic cats, they needed to know about transfusions. They needed to know about cat blood so that they could try to save these animals. So here are my references. And if I go back again, the focus of this was to talk about red blood cells, how that affects our blood types, and the importance of understanding those two things for doctors or vets with transfusions to be able to save lives. Thank you for watching and listening.